So my guest today is the lovely Deborah. So I am so excited to have you on. Not that it were only less than 24 hours since I last saw you in person, but we've decided to do this podcast, haven't we, off the back of what happened yesterday. So I think we'll start first by you just letting yourself be known to everybody. Do you want to introduce yourself?
Yes, thank you for that lovely introduction, Deb.
It was good, wasn't it?
We did have a fantastic day yesterday. I'm just so happy to have met you. And I'm
I
so
know.
happy that we're doing work together and we're going to carry on working together in the future because, you inspire me. And, when you told me about what's happened to you and why you set up Resolute, I think you're absolutely amazing. So I'm really looking forward to working
Oh,
together going forward. Um, so a bit about me then, just so your followers know who I am. I'm Deborah Alderson. I have just done 30 years in policing, so I worked in Northumbria Police and I've done loads of different roles. So I started as a PC on the beat, as you do. Worked in neighbourhood policing, intelligence, but I've actually spent most of my career in investigating crime and serious sexual assaults and the public protection arena. So I worked my way through the ranks and ended up as head of safeguarding department. I've done head of criminal justice and custody, head of force communications, and in the last part of my career, I was a temporary assistant chief constable. I think my focus all the way through my career has been public protection, and working as a detective and working with neighbourhoods, and specifically, I'm really interested in addressing domestic abuse. And I think that the part of my career I love the most, I've loved all of my career. I loved working in policing. The part of my career I loved the most was when I spent about 6 years working for the Police and Crime Commissioner and Northumbria Police and bringing in a number of different innovation projects all about domestic abuse and trialing ways of making things better for victims, how to target perpetrators better, how to get the most impact with, the little resources that everybody has, and bringing organisations and victim support agencies together to work with a whole system approach. So
yeah,
that was the title of one of my projects. It was a whole system approach, domestic abuse, a whole system approach, and did loads of work around educating children in schools. Um, I really do feel like children are our future.
yeah,
And if we really want to have an impact, we need to educate at a very young age and help children understand what healthy relationships are and what they're not. Because it's
yeah,
really difficult for a child that's been brought up in a household where, they might experience domestic abuse every day. They think that's normal. It becomes normalized behavior. And research shows that if that happens, those children, unfortunately, very sadly, are more likely to either become victims or perpetrators of domestic abuse because that behaviour is normal to them. So part of the work that I did, it was called Operation Encompass the Next Steps, and it was about delivering a programme through I can never say that, PSHE lessons in schools, age appropriate from ages 4 right up to 16.
yeah,
And it wasn't like, we didn't go up with 4-year-olds and start talking about domestic abuse, didn't use that language. It was a programme of work I'd worked on with Bernardo's and with education professionals so that children understood what's appropriate, what's not, what's healthy, what isn't, right up to those 16-year-olds and slightly younger who are in those intimate partner relationships and start to experience coercive control and those sorts of behaviours. And God, you know what? That work was amazing. You could see the light bulb moments of some of the
yeah,
children where you could actually see, oh, wow, that's not acceptable behaviour. And having those open conversations and, the amount of children that impacted on was immense. And I loved that.
Yeah,
And
I can't, but I don't understand why it's not in curriculum. It absolutely should be, because that's where we need to start with all of this, right at the root, and try and educate them at that sort of young age before it gets too late. But I can't understand why we're always focusing on crisis. I mean, we've had this discussion before, haven't we? There's so much of it that can be prevented. And ultimately, that is right at the very beginning of it all, isn't it?
it is, and it's primary prevention. And I ask the same questions as you. You know, why isn't this not in the curriculum? And I think the simple answer is the curriculum set by government for schools, and the government say that schools have to have PSHE, but they don't then set the curriculum for PSHE. And at the time I was working on this, they were talking about making it a bit more prescriptive, but they like to leave the schools the flexibility to deliver what they think are the important things in their areas. So leaving the school with the flexibility to do that. I have to say, every school in the Northumbria area where I delivered this engaged and adopted the sessions with the school. So they all, none of them said, "Oh, we don't need this." You know, they all said, "Oh, this is brilliant. This is really helpful," and loved the fact that they were getting some enhanced input. Um, so so yeah, I love that, and you're totally right. And the other bit I did around that in that period was the MATAC, and this leads into what we were doing yesterday. So
Yeah,
the MATAC, one of the proposals back in 2014 was around multi-agency tasking and coordination. That's MATAC, focusing on the most harmful domestic abuse perpetrators. And I piloted that in the Northumbria area initially, and it was all about prevention, education, diversion, disruption, and enforcement for those most harmful perpetrators. So, working as a multi agency, devised a way to identify who was causing the most harm, and then as a multi agency, tackling. You know, and I use the word tackling because it wasn't always about arresting people because it was intelligence led, so it might not be, you know, it wasn't a response to an incident that had happened right there and then. It was looking at, you know, harm caused over a period of time, and then going to all agencies to say, right, what's the best way of stopping this person causing more harm? You know, is this a perpetrator who might engage in a behaviour change programme, for example? Most weren't. Being realistic, less than 5% of perpetrators want to change their behaviour, is what we found in this
yeah,
programme of work. But then it was looking at enforcement, housing is an approach to helping to manage perpetrators, because one thing I felt really strongly about, and I know you do as well, Deb, is that
yeah,
victims, if they don't want to leave their home, they should not have to leave their home. They shouldn't have to go and live in a refuge. So housing companies are
yeah,
so important here, and we had really good engagement from housing organisations in the Northumbria area for this project who helped to look at, you know, housing a perpetrator because it would help a victim. It allowed a victim to stay where they wanted to stay with their support network, where their kids go to
yeah.
school. Because, you know, we've talked
And
about
that
this, haven't
is,
we?
yeah, that is just so important. It's like I said to you yesterday, you know, I want like the next generation to look back and be like, my God, can you remember when we used to put women and children in these places? It's just, it's beyond belief that we're sort of applauding the fact that we're putting women and kids into refuges and safe places, you
Hmm.
know, when ultimately they've done nothing wrong, but
Yeah,
they are the ones that's being punished for it all. And it's just not right. Again, it's all back to front. We're sort of putting all the responsibility and the onus on the victim continuously.
yeah,
And this is what we wanted to bring to the forefront at meeting yesterday as well, didn't we?
yeah. We did, and just to finish off on the housing point, because I think it's dead important. This is where I met my current business partner. So, um, having retired from policing, God, it was 4 weeks ago. It
Yeah, not
seems
long.
like longer.
Yeah.
And Dr. Kelly Henderson is my, we're co-managing directors now of a community interest company called Addressing Domestic Abuse. So back in 2014, when I was doing this MATAC work, I met Kelly because she was a housing professional, and her focus was on how housing providers could help stop domestic abuse, help domestic abuse victims, help focus on perpetrators. She's awesome. Kelly is awesome. You'll love her when you meet her. I know we're going to get together. And
Yeah.
we do a lot of work with housing providers now because they can play a massive, massive part. And we're all about, if a victim wants to stay in their home, they should be able to stay in their home. So we'll continue with that message and try and help with that. So back to our meeting yesterday, part of what I did then was trial using what I call the GPS domestic abuse proximity system. And so I did this back in 2014 and trialed this approach. And then you set up your petition in 2013 for exactly the
No,
same
no,
thing, but
no.
not
So,
knowing
so
about this work.
no, I set the petition up in 2022. So
Right.
I started writing to the Home Office about, through my lived experience of our non-molestation order being continuously breached.
Mm.
And I saw for myself, what could prevent this, because as most victims know, when they've got these non-molestation orders in place, they're good at police station, they're reporting that it's been breached, nothing's done, they're not being enforced. Again, it's down to the victim to try and prove that it's been breached. It's that re-traumatization. And I kind of thought that there must be a better solution to this. And I think there was somewhere in America that was doing it, the tag and app system. And I was like, my God, it's just a no-brainer, like we keep saying, don't we?
Yeah.
So I'm just going to explain to everybody how we came about meeting. So
Yeah.
I set the petition up in 23, and then I'd actually had some correspondence with Dame Vera Bird. And through that, then I sent her my petition, and she then said, "Oh, you must contact Deborah Alderson." So I did, didn't I, through LinkedIn, and the rest's been history, really. This pilot, this was piloted by you back then, and we've sort of worked together since as a dynamic duo, I think. And it's just been like a bit of a whirlwind, hasn't it, since we've got together. I mean, we met yesterday for the first time, didn't we, in person, and we're just hugging each other. It was just brilliant to just see you in person. But then I'm just going to let you go on to finish off saying, what the pilot entailed and your findings, the data and things like that. And then we could talk about what the rest of the world are doing and, how it's been proven that it does work.
Yeah. So the proximity system, what is different about that to what is in place now is a victim has a mobile phone, and you install an app on the phone. I mean, when I piloted it, we didn't have the app. We had to give the victim a separate device. Technology's moved on. We're 11 years on now, so you just install an app on the victim's phone. The perpetrator is given a tag in the traditional sense, so an electronic monitoring tag on their ankle. And they would be given this, our proposal that we talked about yesterday with Sir James Timpson and the Violence Against Women and Girls Minister Alex Davies-Jones. We said, there's no reason why this can't be used for prison release. So where you have conditions on prison release when people are on probation, using them in conjunction with DAPOs. And, I'd like to see it explored to be used for police bail conditions as well when it's appropriate. So app on a victim's phone, tag on a perpetrator, and then you set the proximity to whatever is appropriate. It'll be different for each case. If those two things, those two devices, come into proximity, an alert is set off. The alert system is monitored, and then the person who's monitoring that can pull up a GPS lifetime map and see where the perpetrator is and where the victim is, and they can decide if there's any risk. So in some cases, there might not be any risk. They might just look and watch for a while, monitor, and then if the two go in different directions, that's fine. If there is a risk, they take appropriate action, and that's going to be different each time. But ultimately, if you look at that map and a perpetrator is moving at speed towards a victim, you can see on this system direction of travel, speed of travel. If you look at that and you can see that victim's at risk now, um, you can take whatever action you feel is appropriate. That might be to call the victim and say, right, you need to make yourself safe. There's going to be a high grade 1 police response. They'll be there really quickly. And what that does is give the police those critical minutes to intervene before harm is caused. So, firstly, hopefully, police will get there and intervene before that harm is allowed in those situations. But also, when there's a proximity breach, you're not relying on a victim to give evidence of the breach because all of the evidence is there, it's recorded digitally, so you're not re-traumatizing that victim, getting statements for every time there's a proximity breach for the tag. So, it's fantastic technology. The technology's there, it works in other countries. And yesterday we talked about it's business as usual in Spain and in Portugal and several other countries as well, with a big evidence base of the positive impact of that.
And the fact that there's been 0 femicides in Spain since this has been implemented. And we just used. And it's just a no-brainer as far as we're concerned. And we did take that to Westminster yesterday, to the Ministry of Justice. And I think, do you know what? We did smash it. We did our part, and we did present that in the best way that we could. And I do think that they were listening. And I think we were both quite confident and hopeful that they are going to take this seriously and pilot it, aren't we? Because, it absolutely needs to be put in place. The amount of women that are losing their own lives to intimate or ex-intimate partners, and now with new reports, which didn't particularly shock me, there are actually more suicides. The suicide rates are going up with a very strong link to domestic abuse. Now, that doesn't shock me at all, and I see it from both sides of the fence. I've seen it from being a victim survivor to supporting victim survivors. And for me, it's the trauma of not, once you've disclosed what's happened to you, you expect to be kept safe, you expect to be listened to, you expect to be treated with empathy and care. When we have women that are referring to us, we create a care plan for them, because that's exactly what they need. They need a hug. They need to be told that they're going to be okay. And we will fight as much as we need to make sure that happens. And from our point of view, we use an holistic approach because we find that better. And it's like the police officers or social workers or whatever, if they were taught and educated in a way that they also use that holistic approach around victims that have been traumatised, they would get a better response, a calmer response from that victim when they are disclosing further abuse that's occurred to them. And I just think there's 3 pillars to all of this. There's the education side of it, which is absolutely crucial, because we've spoke about at minute it's been in the in news that it's dash assessments that are the reason why victims are being failed so poorly. And both me and you have said you can't put that on that assessment.
No.
It's down to the people that are filling those assessments in that aren't trained properly.
Yeah,
And
and I
that's the
mean,
key to it all.
yeah, and I think one other point just on that dash risk assessment, there's been a lot in the social media about it, and there's only one cause of domestic abuse and domestic homicide, and the only cause are domestic abuse perpetrators. And
Yeah,
I really hate seeing people writing and in, journalistic reports saying the dash risk assessment is the cause of someone's death. Well, it isn't. The
yeah,
perpetrator is the cause of someone's death, and there's no getting away from that whatsoever. But the dash is just an indication of risk. It's one tool in a system where it can only be used as well as the point you've made is absolutely spot on. It can only be used as well as the person who is using it has been trained to do so. So it depends on that person's experience and knowledge. Um, but and sometimes the training isn't as adequate as it needs to be. But
mm,
ultimately, no one's responsible for someone's death, homicide, than the perpetrator.
yeah.
So I think to blame
And then I
a
think that's
fall
where
is
we,
unfair.
yeah, and I think that's where we're just losing focus of actually what is
Yeah,
the problem here. And the problem
yeah,
here is the perpetrator, and
yeah.
this is why we wanted to push
Back to the tags.
yeah, exactly, because the thing is, at the end of the day, choose which way they look at it, there's no deterrent in place.
Yeah,
And I think perpetrators, from what I see, they're very clever at knowing exactly how this system works, and they know there's no deterrent in place. Um, and in some cases, I think that if this was clamped down on straight away, we would see that half, we said this, didn't we? They would half violence against women and girls.
yeah,
If they implemented this properly, it would definitely half it. We've both said that. I can't see how it can't not, because no piece of paper is going to keep a victim safe. No smart water is going to keep a victim safe. This is the only thing that will truly keep victims safe and allow them to be able to live a life as safe as possible, really, for themselves and the children.
yeah.
But it also said, didn't it, in the reports and research that's been done, the reoffending of perpetrators went down really drastically, didn't it? Well, it's
Yeah.
65%.
That was for the MATAC, so the wider program, the multi-agency tasking and coordination process. So for every offender looked at in the MATAC process, the reoffending rates were between 65 and 72% consistently. And so the MATAC is still in place. It should be in every police force in the country. And that's what that's what I piloted in 2014, and then the Home Office paid me to roll it out across the country. So, and that's the education. There are lots of different tactics as a toolkit, and lots of agencies work together, led by police. But for the tags, there is evidence from the Spanish model and the Portugal model that also prevents the femicides and reduces reoffending when the tags are in place. But I've seen testimonies from perpetrators who had the GPS proximity system um, used with them, and what they said was in the testimonies they knew that they were monitored 24/7. Exactly what you've just said. They knew there was going to be a consequence if they breached the proximity device. Therefore, it made them change their behaviour, and they just didn't do it because they knew it was going to be responded to immediately. So, it even helped them get into new routines because they knew they couldn't carry on doing what they were and hassling the victims and re-victimizing them. So the evidence is there, and I agree with you that I think the ministers yesterday were really positive. It's great that
Yeah,
they invited us in to hear the proposal. They listened. They
yeah,
even we had a follow-up meeting with a number of business leads who were asking really good questions about the practicalities of how it worked and how the trial went, and your victim's perspective in that. So they asked all the right questions, and they really were very positive about how it can be taken forward. So I'm just really looking forward to see what's next. And I
yeah.
really would love to see this in place really quickly
Yeah.
and get it piloted somewhere, and then look at how scalable it is.
Yeah, absolutely. And then we're going to be on to the next mission, aren't we?
Yeah, yeah, whatever that may be, and it doesn't need to be just one.
Exactly.
You know, we've
No,
got
well,
several,
there's
haven't we?
that's it, because there is so many, so many issues around it all for victims. There's the family court situations, which we touched upon as well, didn't we? Which I've experienced firsthand from both sides at fence. But my answer to that is they need opening up. That is what I can see. That to me would make it more transparent as to the fact that, there should be some accountability somewhere with that, because at the moment, while the doors are closed, then how can anything change within those court arenas? But the amount of victims that are, it's just horrendous, the way that they spoke to us some at time, the way that they treat, the way that the victim blamed. But again, all of this goes back down to education. They just need to keep, and the fact that they've just slashed all funding for services to be able to support victims through this entire process is, well, it's soul destroying. It's soul destroying for us, and it's soul destroying for many other services like us, when we're just trying to do us best. It's like I mentioned to you yesterday, we've got other services like mental health, social care, police referring into our services, when we ultimately, our hands are tied because we haven't got the funding to be able to deliver services that we want to and need to. But
Very
we've just got to
difficult.
all. It is difficult. It is, and it's so hard as well when you can see what needs to be done, and a lot of it is common sense, common sense stuff. But I think when you've lived it, and when you're in this sector and you're living and breathing it, and it becomes so transparent, like, you can see behaviours that perpetrators follow. It's almost like a rule book. When women come to me and they start disclosing what's happened to them, I can almost finish off what the end of the story is going to be. And unfortunately, it's not always an happy ending. But if this this will save lives, and that is what is so important. The fact that we know, because it's been proven, particularly in Spain, that it will save so many lives, and that's what we're here for. That's what we need to do. And we touched upon also, we want to focus on the suicide side of it as well, don't we?
Yeah, I mean, it'd be really good to understand more about the links between domestic abuse and suicide, and to look at what more can be done to prevent suicide in those situations. And it's really difficult. I think we're just, it's that old tip of the iceberg at the moment. There's not loads of research about it, and we've only just started including those suicides in the, what we used to call the DHR process, the domestic homicide review process. Probably should have been doing that for a lot longer than has been. But at least now it's starting to get recognised. But I think the next steps for me are, what can we do about it? How can we prevent this? Because it just shouldn't happen. It's unnecessary. It shouldn't happen.
But again, for me, it goes down to education again, Deb, because a lot of time they've already had other services involved that have not recognised domestic abuse within the homes. It absolutely baffles me that we've got frontline services like ambulance crew that are going into households. They have no training whatsoever on domestic abuse. We have firefighters, again, no training. We have social care. Most of them have 20 hours within their training to be a social worker on domestic abuse. And considering the high levels of domestic abuse cases that there are, how is it possible that they are not even having a basic understanding or a certain level of training?
Yeah.
And it's there. It's that what we need to try and push. It's the training, the education, the society's perception on it. It's sort of that. And unless we speak about it, then we're never going to change any of that. I don't particularly like having to, speak about what happened to me and my kids. But if it means that it's going to help others, then that's what needs to happen. And as you know, I hate doing media. I hate it. But again, I've got to do it, Anna, and that's it. It's my strong, broad Barnsley accent that comes across in there. But I think some people kind of resonate with me because I am just a Barnsley lass that, has experienced this for whatever reason. And it's now putting me in a position where I can help other people. And if that, and I know that Resolute has saved lives because we have been there to catch them. So, and advocate for them and stuff like that. It's just such a shame that we can't do that more. Yeah. But we have to collaborate, which we're hoping to do.
What you've done and what you've achieved is absolutely fantastic. You are amazing. What you've been through and experienced with your personal trauma, you and your family, is absolutely horrific. Something that someone shouldn't have to go through. But you've come through it. You've taken that. You've used your experiences to create Resolute, and you're now helping people. So it's people like you that inspire me to do what I do. And I think, my God, if you can do that, I can at least do my bit.
You're amazing at your bit. Well,
yeah,
you are absolutely fantastic. When we were in that meeting yesterday, it blew my mind. But I could speak. I just wish sometimes that I could articulate myself better. That's what it is. But I think with ADHD brain, that's like continuously, I can't get my words out fast enough sometimes. But
well, I'm looking forward to seeing what we do next, and just seeing how this one pans out with the proximity system. I'm hopeful. I really am.
Absolutely. So this will be part one of many, because there'll be more to come, I think, and we're looking to move forward together and work together, aren't we, and collaborate with other services, because ultimately that's what is going to make the changes that are needed. We have to all collaborate and support, because if we're not doing that, how can we support others?
Exactly.
But yeah, we'll arrange that meeting for next week and we'll get cracking.
Excellent. Can't wait.
No rest for wicked for the two Debs.
None whatsoever.
Right, I'm going to love you and leave you, but I will probably speak to you later anyway.
Lovely to catch up and lovely to meet your followers.
Yeah, so thank you. I'll speak to you soon.
Deb.
You will. Right, I'll speak to you in a bit.
All right. Cheers, my dear.
Bye.